Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for my continued followers, I want to say thank you. And I got to give you something straight out of Maryland. We've talked about different crime stories and things that have taken place in other cities like Alabama, Chicago, New York City, LA, and this one. And we've talked about lawyers, judges, teachers, and this one I'm going to give you about a dentist. Dentist James Ryan found guilty of murder and anesthesia overdose death. The 50-year-old oral surgeon in Maryland was accused of introducing his girlfriend to the drugs and setting up an IV system at their home. An oral surgeon who gave his girlfriend addictive anesthesia solutions and set up an at-home IV delivery system was convicted of depraved heart murder in her fatal overdose in Montgomery County, Maryland last year. This is a very interesting story. James Ryan, 50, Dr. James Ryan, faces up to 55 years in prison for murder and other counts when he is sentenced at a later date for the death of Sarah Harris, 25. He's 50, she's 25. He's old enough to be her father. Jurors saw and heard repeated evidence of his dangerous conduct over an 8-day trial that tracked her worsening addiction and health. Harris, the woman, was just 83 pounds when she was found dead inside Ryan's Clarksburg home on January 26, 2022. Autopsy results showed that she died of intoxication from ketamine, propofol, and diazepam, which is Valium. Relatives who had been inside the house in her final months told jurors about finding drug vials, bloody towels, and tubing and an IV pole next to Harris's bed. So he was doing the same thing that Michael Jackson's lawyer was doing to Michael Jackson when Michael Jackson overdosed on propofol and died. In laying out their case for depraved heart second-degree murder, prosecutors did not have to assert that Dr. Ryan, premeditatedly killed Harris. They instead argued that as an oral and maxillofacial surgeon well versed in anesthesia, he knew how dangerous the drugs were for Harris and showed an extreme indifference to her life by continually bringing her drugs and setting up a home delivery system. He's setting this woman up an IV in his house and giving her propofol, ketamine, and diazepam on a regular basis. Man, you talk about Russian roulette. Dr. James Ryan, a well-trained oral surgeon skilled at what he did, an expert in his field, he knew the risk of these drugs better than anyone. Montgomery County Assistant State's Attorney Jennifer Harrison told jurors. And despite his vast knowledge and training in the field, he continuously provided these dangerous, deadly anesthetic drugs to Sarah Harris over a period of time, even as he watched her deteriorate before his eyes. And remember, she's only 25, so she's got a lot going on in her life for her to be in such a depraved, depressed state. Every time he gave her those drugs, whether he administered them or whether he instructed her on how to administer them to herself, a little bit of Sarah died, Attorney Harrison said, until he gave them to her one too many times and he killed her. He killed Sarah Harris. He created this risk. Ryan did not testify. His attorneys told jurors about Harris's mental health struggles and argued she died of either suicide or an accidental overdose that she administered to herself. Harris had asked Ryan for ketamine for relief from her depression and dark months prior to her passing, defense attorney Thomas DiGione told jurors. He noted that Harris's brother had recently died. On January 25th, 2022, the day before she was found dead, Sarah Harris spends the day with her mother visiting cemeteries and burial plots where she was going to bury her brother. Jurors began deliberating Friday and came back with a verdict the same day. Ryan formerly ran Evolution Oral Surgery on the third floor of a medical office building in Germantown. He met Harris, a former beauty queen, in 2020 after she came to him for wisdom teeth work, according to prosecutors. He later hired her and they began dating. In time, Ryan also offered to help her anxiety by giving her sedatives from the practice, prosecutors told jurors. In February 2021, he told her, well, if you want, I can give you an IV injection. I can make the anxiety go away in a few seconds, Dr. Harrison said. Sarah was a bit confused by this, but she took him up on it. And then that started the cycle of Dr. Ryan offering to bring her home drugs, ketamine, propofol, and midazolam, from his practice to give to Sarah Harris to help her with anxiety and help her sleep, similar to Michael Jackson. After their relationship grew closer, according to testimony, Harris use of surgery medications increased. Jurors also learned how propofol was linked to a celebrity death. It's the anesthetic agent used to put patients to sleep, and it's the same drug that Michael Jackson was using when he passed away, said witness Gary Warburton, chairman of the Department of Oral and Maxillofacial Surgery at the University of Maryland School of Dentistry. Prosecutors called him to draw out the stark contrast between the oral surgery care offered in medical settings and that absent from Harris's use of the drugs at home, without safety equipment, surgical assistance, or advanced medical monitoring devices. Under questioning from Assistant State's Attorney Jim Dietrich, Warburton told jurors how oral surgeons always keep nearby a cart filled with safety equipment, otherwise known as a crash cart. If someone is having an adverse event under sedation, it contains everything from drugs to IV access to airway adjuncts, nasal tubes, and even endotracheal tubes. Warburton said defibrillators should be on hand and spoke of other safety measures to provide safe sedation, such as monitoring a patient's heart rate, blood pressure, blood oxygen levels, and breathing. When it came to Sarah, Harrison told jurors, Dr. Ryan left her unmonitored. Oftentimes he would leave her and go to sleep for the night, leaving her hooked up to an IV on these dangerous drugs. And she ended up dying. What a story. Not only was she having mental issues and stressful issues in life, but Dr. James Ryan had to be suffering from either narcissism or a godlike sense or just callousness to where he didn't care what happened to this young lady. If you're putting somebody to sleep, of course, I've had wisdom teeth taken out. People have had surgery. I've had upper and lower GIs in hospitals. He was allowing this young lady to be hooked up to an IV using propofol, ketamine, and diazepam and not monitoring her at all. First of all, it's a violation of his license to be doing that at his house, and she was not a patient. He's taking these items home with him. That's a violation of the law, and he's not doing this in a medical or dental office setting. He was playing Russian roulette with this young lady's life, and guess what? The wrong bullet was in the wrong chamber. And now he's looking at 55 years in prison. He was twice this young lady's age. He had no business dating her from the start. She was young enough to be his daughter. And we have to be very careful. Even though they're professional, judges, lawyers, dentists, police chiefs, they're still human beings. And we make mistakes each and every day. He is going to end up spending the rest of his life in prison as a result of this. And she ended up dying. Tell me what you think about this case on dentist James Ryan out of Maryland. And his girlfriend ended up dying to and IV use of drugs. Interesting commentary. This has been the Trevor Donald Experience. Manifest your truth in a positive, righteous, and God-fearing way.